Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. We actually have a returning guest on the program this morning, Mike Critelli, who's president of Dossia, one of the leading health management engagement platforms in the marketplace. And Mike, welcome back to the program.
Thank you very much. I'm pleased to be back on the program.
Yeah, good to have you with us. Give our audience, to start off, a nice overview of Dossia and what your niche in this space.
Dossia is a platform that's been in the market for 5 years, and it helps both individuals aggregate all their health data and manage health and healthcare. And more recently, what we've built into our platform is the ability of health plans, employers who manage the health plans, health coaches, and even provider systems to look at population-level data and react quickly and precisely to emerging trends. We are at a point now where a good thing that I think has come out of the Affordable Care Act is the recognition that health and healthcare have to be managed continually, not in once-a-year enrollment processes. And so Dossia has adapted to that reality and built out a very robust platform to do that.
Hey, Mike, what is the target size of company that this is a good fit for?
I would have given you a different answer 2 years ago than I give you now. I would have said that our target customer when we started was the very large self-insured employer, 10,000 employees and up. Mm-hmm. But given what's happening with the Affordable Care Act, third-party administrators are going to employers as low as 25 employees and moving them from insured plans to self-insurance with a catastrophic insurance coverage for the population. Dossia is embedded into the platforms that those third-party administrators are offering, even to the smallest businesses. So it's quite a broader market than we originally anticipated.
Hey, Mike, it's Ron Bachman here. I want to come back to that in a minute, but for our audience, the whole idea of population management can be confusing, especially in the area where they hear terms like personal health records, electronic health records, PHR, EHR, all the, we get into this terminology in our business that can be confusing to the public. Can you explain a little bit more from your perspective what these mean or which ones you use or how they're used by your product or by the publics? Just clarify a little education, if you will, around personal health records.
Yeah, thank you. That's a very good question. The electronic health record is used by doctors and by hospitals to manage both their clinical and their claims presentation processes. So that's for the purpose of helping doctors do their job better and get paid. And when they make that record available to a patient, it usually doesn't work because it's in medicalese. Mm-hmm. A personal health record is a layperson's version of that record, but more importantly, it pulls together records from all the doctors and hospitals that we go to. None of us in our lifetime will go to one doctor from birth to death. And what we have developed is a portable, lifelong, comprehensive record. So that's the personal health record system which Dossia started with 5 years ago. What we've come to realize is when you're a health plan administrator, you really want to know, are we seeing an outbreak of type 2 diabetes cases where we have to create a wellness program designed around type 2 diabetics that can't wait until we do the rollout of next year's program. We want to get something out to people right now with recipes and incentives. So population health gives a health plan the ability to move rapidly as things are happening within the population, as opposed to what's historically been done, which is a once-a-year enrollment and a once-a-year rollout of incentive programs and health management programs.
Hey, Mike, what do you see, with the last couple of years' experience, what do you see the patients doing with the record? How are they utilizing and really using the record?
The single biggest use of the record is that patients go to their primary care physician for the first time and show that doctor with professionally sourced data where else they have access to the healthcare system. And the most common and beneficial use of that record, because we not only aggregate all the doctor's visits but all the prescription drugs and over-the-counter drugs, is that the doctor will realize for the first time that patients are taking multiple medicines, some of which interact adversely to other medicines and cancel them out. So the doctor will say, well, drug A and drug B interfere with each other, so you got to we got to give you an alternative to drug B. And that is the single biggest use of a record. The second biggest use is for telemedicine or other applications where people simply have to go and get prescription refills, and somebody can work with pre-existing records so they're not dependent on data the patient gives them. And finally, just managing a family's immunizations, screenings, physicals that are required for schools or outside activities. It's a very helpful tool for the mother, who is usually the care leader for the family.
Mike, a lot of our listeners out there, lay people or maybe people casually involved in the healthcare system, may have a sense that the prescription drug process is in the electronic world out there, that there's information flowing back and forth when they go to the pharmacy and pick up. So that may be one of the most electronically available pieces of information to put into a file. How does the other information get in? How does my office visit or my immunization records get into the file that you're talking about?
It can get in through really two ways. One is through the physician or the doctor downloading the information directly into a Dossia record, and that's emerging as time goes on as more common, but still the minority of the cases. Mm-hmm. The most common way is through the insurance claims process, because almost everything we do today gets paid for by some form of insurance or gets recognized as part of the deductible. Mm-hmm. And the explanation of benefits that today we receive, one at a time, those explanations or codes get into our record, translate it into lay people's language in a way that's usable for them.
So you have some contracts with...
The claims process is the most common. Pharmacy data gets in regularly, right. And what we add to that is a software application that points out not only adverse interactions, but dosage adjustments, notifications about side effects, recalls, batches of a particular drug that somebody can check. None of that's done by the pharmacies or the pharmacy benefit managers to the degree that we do it today.
So do you have contracts with all the major insurance carriers to gather that claims data to put into your records?
Yes, we have the contracts, and the reason that works is that going through either a large employer or an independent third-party benefit administrator, they make that a condition of doing business with the large health plans. Mm-hmm.
So if I'm trying to follow my biometrics, blood pressure, cholesterol, A1C levels, and because my employer, many of them these days are doing rewards and incentives off of that, am I getting that information? Because that's not usually part of a claims record, is it? How do I, or can I use the record to get that kind of detail on my health history?
Well, you can clearly get it from the clinical record if you're set up to have that downloaded directly. And as I said, that's still a small percentage of the cases, but it's growing because doctors aren't going to get paid in the future if they can't show that they can meaningfully use those records. And one of the standards of meaningful use is the ability to get the doctor's record in a patient's hands. But we also do a direct feed from biometric systems and devices that record that data. And we're qualified with a number of those devices, like the Fitbit devices and other systems that do blood pressure and weight and body mass index and some of the other non-invasive metrics.
So is that the wave of the future to get those kinds of personalized devices?
For blood test results. The obstacle there is not technological, but the fact that in many states you can't get lab data directly to the patient.
Hey, Mike, time flies when we're having fun. We've got about a minute to go, and I'd like to give you about 30 seconds or so to give our audience a couple takeaways and how they can find you.
Well, you can go directly to our website, which is www.dossia.com. We also have a direct-to-consumer website for people that are not on any health plan called www.lively.com, which I think helps people self-manage and get it's a great social networking and posting site. But we're really going out and trying to continue to be more user-friendly as more and more people are getting to pay a much bigger percentage of their health care bills.
Sounds good. Mike, listen, we really appreciate having you on the program again. Look forward to talking to you in the near term. And to our audience, stay tuned for the next segment, Healthcare Consumerism Radio.